tricky. So there are a couple of ways that you can try to navigate that. The internet is a powerful thing, and if you do have a computer, it can be helpful or it can be useful if you go on Google and then you can look at Google a medical facility or hospital. So, for example, if I don't have a doctor in Vermont, I could look up the University of Vermont Medical Center, and then there's a link that says find a provider or find a doctor, and you get a list of all of these doctors in the organization, and they have profiles on the doctors, what types of insurance they take, what their specialties are, what they like to do, what they prefer not to do as far as taking care of certain types of patients. Like some patients will be, or some doctors do OB-GYN care and some doctors don't, but you have the option of deciding. And there's a phone number in general where you can call to try to make an appointment. And when you try to make an appointment with your doctor, they will, or with that doctor's office, there's generally a request for information that they'll need. And usually those are things like, where were you born? Your date of birth, your age, your phone number, emergency contacts in case something happens, your driver's license or some type of federal identification, your medical history from other facilities if that's available. But then the other thing they will want is insurance in most cases and situations. And that can be a big barrier for a lot of people too, because insurance is an important way of sort of paying for your medical care, especially since, not many of us can give away $5,000 when we're doing a lab test. I wish I could do that. That would be great. But so insurance can be very helpful for that. So to get insurance, fortunately, Google is useful in that, and you can type in "I'm looking for insurance" or health insurance, and many sites initially will point you to sort of finding health insurance that fits for you. And through the Affordable Care Act, which is one of those avenues, they can actually help you navigate that search for an insurance plan, a health insurance plan that would benefit you and or your family. And this can include Medicaid-based care, which is very beneficial for individuals who are low income or individuals who do not have an income per se. So, there's a couple of ways to navigate that process of finding insurance. I do want to also say that there are medical facilities that will offer community-based care and support around that. So the Community Health Centers of Burlington is a great example in that many refugees or individuals who are just coming into the country and don't have a doctor or insurance, they can be seen at that office, and the group there will work together. Their social workers will meet with the patients and come up with a plan of finding insurance, of finding ways to pay for their medical support and care, and any additional services as well too. So there are medical facilities that will focus quite strongly around those specific things too. So there is definitely a need and a desire for more support around it, and it's just hard to find sometimes. But those are some ways.